Well, hi everybody. As Shannon said, my name is Rachel Witthoft. I'm a healthcare policy analyst at the Wisconsin Department of Health Services, and I'm here today to talk with you about the upcoming healthcare policy changes for inmates. All right, so just a quick agenda for my part of the presentation today. I'll just be talking with you about goals and background, the policy changes overview, some general information, suspension for existing healthcare members, suspension for new applicants for healthcare, some special rules around the suspension policies, what happens to redetermine eligibility at release, and then some more information about what members can see as far as access and my access, and then also in the communications that are sent to members from DHS or the income maintenance agency. So the goals of the policy change here, we want to improve health outcomes for people who are released from jail or prison into the community. We want to comply with federal requirements, specifically those in the Federal Support Act. And we also want to simplify processes for individuals, income maintenance and tribal agencies, also known as IM agencies, and correctional facilities. So just a little bit of background. So under federal law, Badger Care Plus and Medicaid for the elderly, blind, and disabled, also known as EBD Medicaid, may not pay for health services provided to incarcerated individuals, with the exception of someone who is outside a prison or jail for 24 hours or more. For example, a person who's admitted as an inpatient to a hospital. So this coverage restriction is current policy and is not changing with these new policy changes. So again, this coverage restriction is current policy. So the current policy on the eligibility side, so Badger Care Plus and Medicaid have had a long-standing policy of terminating eligibility when someone is incarcerated, and then requiring a new application upon release if the person wants to regain their healthcare benefits. Just to note, if an inmate is in a Department of Corrections, a DOC facility, and is hospitalized for 24 hours or more, DOC has assisted with completing a Badger Care Plus or Medicaid application for that person, and then DHS determines eligibility, and if eligible, only opens Badger Care Plus or Medicaid just for those dates of hospitalization. So that's how that coverage, that current policy on that hospital coverage was enacted. So with the new policy, so the Support Act requires states to suspend instead of terminate Medicaid eligibility for juveniles who are incarcerated. So effective October 24th of 2020, DHS plans to suspend healthcare eligibility for any inmate, regardless of age, for certain healthcare programs. And so this is just sort of a quick sort of at a glance process chart where you can see that on the left side of the screen, you see sort of how existing members who are open for Badger Care Plus or Medicaid and then are incarcerated, how that flows into the suspended benefits. And then once the member is released, then how the agency processes that change and does the eligibility redetermination. And then on the right side, you see a new applicant who's already incarcerated and now they're wanting to apply for healthcare, how that process also goes into the suspended benefits. And again, we'll touch on this in more detail, but just wanted to provide this sort of at a glance flow. All right, and then so I'll go into programs that can be suspended. So programs that can be suspended, Badger Care Plus, except for pregnant women enrolled in the Badger Care Plus prenatal plan. So prenatal plan will not be suspended, but I'll get into that a little bit later as well. But generally for Badger Care Plus, that can be suspended. The basic EBD Medicaid program for people who are age 65 or older, blind or disabled, but are not getting SSI. So that program can also be suspended. Wisconsin Well Woman Medicaid for women under age 65 who have been diagnosed with breast or cervical cancer or certain precancerous conditions. Again, that can also be suspended. Programs that cannot be suspended. So not all types of Medicaid can be suspended. Some forms of Medicaid will end because incarceration, just like the nature of incarceration, prevents the member from meeting basic program requirements. Some examples of these programs that won't be suspended would be the Medicaid Purchase Plan, long-term care programs. Again, there's just certain aspects within these programs that just the nature of being incarcerated makes somebody ineligible for them. Prior to completely ending healthcare eligibility for a member, though, the IM agency will look to see if the member is eligible for a form of Badger Care Plus or Medicaid that can be suspended. So if somebody is a Medicaid purchase plan or MAP member and they are incarcerated, before completely ending the Medicaid eligibility for the person, the IM agency will look to see if they're eligible for another program that can be suspended, such as the basic EBD program that can be suspended. And if so, the person's eligible for that, then they'll move into that program and be suspended. Pregnant women. So pregnant women who are incarcerated will not be suspended. Their eligibility will continue to be determined under the Badger Care Plus prenatal program, which is a full benefit program that's available today for pregnant women who are inmates. When the pregnancy ends, the member may move to suspended benefits under Badger Care Plus or EBD Medicaid if they are still incarcerated. So I think maybe I'll pause here. Shannon, are there any questions?
Yeah, we actually do have one question. So the question is, what if an inmate shows up to the emergency department with no insurance? Would we not do a Medicaid application for them?
So, so if an inmate shows up to an emergency department, I mean, you can do help them with a Medicaid application or a healthcare application at that point. The regular application that can be submitted through Access or by paper or something like that. And at that point, that application will be routed to the income maintenance agency, and the income maintenance agency will determine eligibility for that person. And so, yes, you absolutely can continue to help people to do access applications, or excuse me, healthcare applications.
Great, thanks, Rachel. We have another question. What about Huber patients? Do they qualify for Medicaid?
So yes, so Huber law. I actually don't think I cover it necessarily in my slides, but I can talk about it right now. So the existing policy right now is that if somebody is participating in a Huber program, if an inmate participating in a Huber program is released from jail to for the purpose of returning to the home and taking care of their minor children, that they are actually eligible for full benefit Badger Care Plus or Medicaid. So essentially for those folks who are released under the Huber program for that reason, we're essentially treating them as if they are not incarcerated for healthcare purposes. So we're not changing that policy. So folks who meet those criteria will continue to be eligible for regular Badger Care Plus or Medicaid, assuming they meet the rest of the program criteria. If somebody is released under Huber law for a different reason, that's not that specific reason about returning to the home and taking care of their children, so they're released for, say, work purposes or something like that, they would still be considered an inmate, and then they could be eligible under suspended Badger Care Plus or Medicaid. So yes, they would have some eligibility, but depending on the reason why they were participating in the Huber program, it would either be full eligibility or suspended eligibility. Again, assuming they meet all the other criteria.
Great, thanks. We've got some more questions.
Sure.
So if the pregnant inmate gives birth and her coverage is suspended, would the newborn qualify for coverage if the mother is suspended? So just to go back to your point, Rachel, that for pregnant women, the coverage is actually not suspended, correct?
That's correct. For pregnant women, they will actually be eligible under the Badger Care Plus prenatal plan as they are today. So when they're pregnant, so we're not changing that. We're not moving them to a suspended benefit or anything like that. They'll continue to be, pregnant inmates will continue to be on the Badger Care Plus prenatal plan. As far as the pregnant woman's eligibility, then once she's no longer pregnant, at that point, she does not qualify for or the Badger Care Plus prenatal plan will end like it does today. But instead of, whereas today, once the Badger Care Plus prenatal plan ends, if they're still incarcerated, they're just not eligible for anything. Once these policy changes go into effect, they may be able to move to a suspended, Badger Care Plus or suspended Medicaid for the rest of their incarceration period, as long as they continue to meet the eligibility criteria for the suspended programs. As far as the baby's eligibility, I believe that I'm assuming that they're asking about if the child qualifies as a continuously eligible newborn. It would be the same policy as it is today, and I will have to I actually have to double check that one on if babies born to women enrolled in the prenatal plan, in the Badger Care Plus prenatal plan, are eligible as KINs. I will have to double check
Thanks for doing that, Rachel. We'll do maybe 2 more and then let you continue on. We're getting lots of great questions in the chat, and we will try to get through them all. We'll just pick back up to the ones we missed at the end of Rachel's presentation. So here's the next one. If someone presents to emergency or inpatient, may an express enrollment be completed? Then a full Medicaid application be done for IM determination. So I would assume this would hinge on, are they in one of the, express enrollment eligibility categories?
Yes, again, I could double check on the express enrollment policy on that. I don't have it on hand, but we are not changing the express enrollment policy. So I believe that inmates, if they are at the hospital and can enroll in express enrollment, and then at that point, after later on, they can then do their full application to get benefits. Again, I will double check on all of that, but yeah, I believe we're not changing the current policy on that.
Great, thanks, Rachel. And I just want to convey, we have heard from another DHS representative on the call who spoke yesterday, Autumn Arnold, that Badger Care Plus prenatal does give the newborn continuous eligibility. So that first year of coverage under Badger Care for that newborn. She checked the handbook for us. So thank you, Autumn. We appreciate that. And then we'll do one more, and we just want to clarify the language around suspended. So what does suspended mean? Does it just mean it's easier to pick up Badger Care on the day they leave jail?
Yeah, so basically suspended is sort of meaning that we're going to keep the person open while they're incarcerated. So they're on an open case, they're an active member. We're just putting most of their benefits on hold. So this will make it easier. I'll get into this a little bit more when we talk about the redetermination at release, but essentially it means that we're not requiring a whole new application for somebody to regain their benefits when they are released. So it'll make it easier, I think, for folks to regain those benefits because they've been, they've continuously been an open member.
Great, thanks, Rachel. Why don't you continue on, and then we'll pick up with questions at another break.
Yep. Okay. Sounds good. All right. So household composition. So if the person is part of a family enrolled in Badger Care Plus or Medicaid, they can stay on the same case and be considered as temporarily absent from the home. This temporary absence can last as long as the person is incarcerated. There's no time limit while the person is incarcerated. So members will be asked to indicate if the incarcerated individual is still part of the household so that workers will know if they need to be kept on or removed from the case. And members can report if this changes later on. So they can say, yes, this person intends, we intend to be part of the same household, but maybe things changed later on, and so they can report, actually, this person will no longer be considered part of my household. So that is available to members to report those changes over time. If someone's no longer part of the household, they may need to apply for benefits on their own case. So if the incarcerated person is not the primary person or case head on the case, they will need to file a new application if they want suspended Badger Care Plus or Medicaid on their own case. So it's very similar to even what happens today when, even for non-incarcerated people, when somebody leaves an existing case, if they want to, have benefits, retain benefits, or keep benefits on their own case, they often need to file a new application. Right, so member requirements. So as I said before, suspended members are open members, so they're subject to change reporting rules, and they must report their changes to their IM agency. The decision of notice that they receive will include the complete change reporting rules for whatever program they're enrolled in. It may include reporting the following changes within 10 days of occurrence: address, income, assets, pregnancy, the people in the household, tax filing status, and tax dependence. There might be more depending on the program. Not all of these would apply depending on the program, but the notice of decision will clearly list out what things the person is obligated to report if it happens. So members are required to complete an annual renewal in order to maintain their benefits. If the renewal is due while the person is incarcerated, they must complete it in order to maintain their suspended Badger Care Plus or Medicaid. In most cases, this will be an administrative renewal, which requires them to review information that we have on file or we are able to get through data sources but then the person themselves may not need to take action other than, again, reviewing that and making sure that information is correct. So again, we're hoping that for most people who are inmates, things perhaps are not really changing on their case over time that much. And so hopefully we'll be able to do administrative renewals for the most part for this population. Suspension length. There's no limit to how long someone's benefits can be suspended as long as they continue to meet program rules. Covered services. So again, during the suspension, Badger Care Plus or Medicaid will only pay for services if the member is hospitalized as an inpatient for 24 hours or more. The member will not need to submit a new application. Members who need other healthcare services should follow the process in the jail or prison facility for requesting services. Badger Care Plus and Medicaid will not cover those services that are not those, you know, where someone's hospitalized as an inpatient for 24 hours or more. HMO disenrollment. So suspended members will not be enrolled in an HMO. If an existing member is in an HMO and is then incarcerated, the member will be disenrolled from the HMO when their Badger Care Plus or Medicaid is suspended. If there are other members in the household who are not incarcerated, those members will continue to be enrolled in their HMO, no changes for them. And then re-enrollment. So when a member regains full benefits at release, they may be automatically re-enrolled in their previous HMO if it's within that HMO reinstatement window. I believe it's 6 months. Asked to choose a new HMO if it's past that reinstatement window or they were not previously enrolled in an HMO, or automatically enrolled in their household's HMO. Again, this is for people who are in programs where we have HMO enrollment. Another note, so for other programs, non-healthcare programs such as food share will continue to follow their existing policies for individuals who are incarcerated. So what I'm talking to you about today is really just about Medicaid and Badger Care Plus. So even though a case may remain open for healthcare, eligibility for other programs may end due to incarceration. So individuals interested in those other programs may need to submit a new application for those programs after they are released. Right, I think I'll pause here again for questions.
That'd be great. And we want to go back and clarify the question about the pregnant inmate who gives birth and her coverage is suspended. Would the newborn qualify or the continuous eligibility? And we got a subsequent update that no. So we maybe read the handbook a little too quickly there. And so while it sounds like people who have Badger Care Plus prenatal because of ineligibility due to immigration status, that is true. But for women who have Badger Care Plus prenatal because they are incarcerated, that is the continuously eligible newborn coverage does not kick in. So I just want to be very clear in conveying that and extend my apologies for the incorrect information that I shared earlier.
Shannon, can I jump in real quick?
Yeah,
And
please.
Just be aware that that individual who is incarcerated will receive medical care through the Department of Corrections.
The woman, or are you talking about the newborn, Lars?
The woman who is incarcerated
Okay.
will receive medical care through DOC.
Thank you for that clarification. And so, yeah, we were discussing something that takes, I just realized I didn't have my video on, my apologies. You know, the one step further, the eligibility for the newborn, that in some cases would automatically kick in, but doesn't automatically kick in this circumstance. But now we will move on to other questions. We have the question, if a Huber inmate did not have Medicaid prior to incarceration, can they apply while incarcerated?
Yes, absolutely. Actually, any inmate can apply while incarcerated. Really, anybody can apply. So we do encourage folks to, if they are interested, they should absolutely go ahead and apply.
And Lars will be talking a bit more about that process in his presentation. So what if the person was incarcerated for more than a year? Are there any time restraints?
No, there are not any time restraints as far as how long a person can be suspended. even if they're incarcerated for several years, as long as they keep meeting the program requirements, which means, if they have any, those changes that's listed on the NOD that needs to be reported, they continue to report that. They continue to do their yearly renewal and submit that in timely and things like that. As long as they continue to meet all of those requirements, they can continue to be on suspended Badger Care Plus or Medicaid for years, for the duration of their incarceration.
Okay, thanks. Next up, if a person is in a federal halfway house, are they able to obtain Medicaid coverage?
Sure. So I think that actually might get a little bit more into sort of the definition of who's an inmate, and what types of correctional facilities are we talking about. And I'll apologize a little bit. I'm not as super, or don't have that information at hand to necessarily give exact information. But generally, when we're talking about people who are inmates, we're talking about people who are involuntarily confined in a facility due to law enforcement authority, in a correctional facility, and they don't have, freedom of movement. They don't have, they aren't able to basically, have freedom of association, freedom of movement, and things like that. So, so as far as folks who are maybe in other locations like halfway houses or other places that aren't actually jails or prisons, they may actually be considered to not be inmates and could be eligible for Badger Care Plus or Medicaid, like anybody else who's living in the community and who's not an inmate. Again, I know there's some gray area for some of these living arrangements, some of these facilities or other places. So I definitely recommend that if somebody is not sure if they would be considered an inmate or not, they absolutely can still apply. They may want to contact their local income maintenance agency to maybe explain their situation and see if they would be considered an inmate and therefore they'd be looking at suspended benefits, or if they would be considered not an inmate and could be looking at full benefits. So I would recommend that. I know situations differ.
Okay, thanks, Rachel. One last question. Just going back to the concept of somebody presenting in the emergency department, can you just review the relation to applying if they're not actively enrolled, how suspension acts in that case, and if they can do express enrollment? One more time.
Sure, I'll have to double check on express enrollment for you all, but
Okay.
as far as applying, so if somebody goes to the hospital or something like that, they can certainly apply, or the people there can assist them with applying. Let's assume that person is incarcerated. They're just in the hospital temporarily to get those services, and then they'll be returning back to the jail or prison. They would, if they file their application and the income maintenance agency finds them eligible, they meet the program requirements, then they're going to be open as in suspended benefits. So they will be open in a suspended status isn't the right word, but their benefits are suspended. There are open members whose benefits are suspended. And then when the hospital bills or does the claims to Medicaid or Badger Care Plus, Medicaid or Badger Care Plus would pay for those, those specific hospital inpatient related bills. I'm sure I'm not using the right terminology here, but so the person remains suspended. But as far as determining which of the hospital bills that Wisconsin Medicaid or Badger Care Plus would pay, that's all done on the claims side, the billing side, between the provider and Wisconsin Medicaid Badger Care Plus.
Thanks, Rachel. One more question, and then we'll do the next session, and we'll do a few more questions then following the next section. Can behavioral health programs, such as comprehensive community services or community support programs, be suspended?
I can check on that. I don't believe so. I think again, so sorry, what was that? It was community support services, and what was the other one, Shannon?
Yeah, comprehensive community services or community support programs. And I can send that to you following the presentation, Rachel.
Yes, I'll have to double check on that. I think off the top of my head, those might have fallen into the programs that I talked about earlier, where there's just intrinsically, there's things about certain programs that make it so if you're incarcerated, you don't qualify. For example, if a program has a requirement that you receive certain services in the community or you receive certain services while living at home, just the nature of being incarcerated, you're not living at home. So that's why, I'm not saying that's necessarily the case with these programs, I'll double check on that again, but that's why some programs we do have to continue to terminate as somebody's incarcerated. But when somebody's released, then they may be able to get back on those services. So again, I'll double check on that, but that might be something where if you have somebody who's in this situation and is becoming incarcerated, it might be worth talking to a caseworkers or those programs specifically to see what's going to happen when they're incarcerated and what they'll need to do to regain benefits once they're released for those programs.
Okay, great. Thanks, Rachel. Why don't you go ahead and then we'll pick up with questions again after this next session.
All right, so starting the suspension. So when someone becomes incarcerated and this information becomes known to the IM agency, their eligibility will be suspended. So for DOC inmates, we expect to receive this information automatically via data exchange with DOC. For inmates of jails, we will continue to rely on direct reporting from members or jails. When an incarceration is reported for an existing member, the suspension will start the first of the month following the month in which the incarceration was reported to the IM agency. So sorry, a little bit confusing, but I got a couple examples here for you. So example one, Olivia is in a household by herself and is enrolled in full benefit Badger Care Plus. On October 26, 2020, an IM agency receives a report that Olivia is incarcerated. The worker processes the change. Olivia's Badger Care Plus is suspended starting November 1st, 2020. Example two, this is a household example. So Ty and Paula are married and have a 10-year-old child, Marcus. All three are enrolled in Badger Care Plus. Ty is incarcerated on February 5th, 2021. On February 10th, 2021, Paula contacts the IM agency to report that Ty is incarcerated, but that she still considers him to be part of the household. So the worker processes the change. Ty's Badger Care Plus is suspended starting March 1st, 2021. Paula and Marcus remain enrolled in full benefit Badger Care Plus, so their benefits do not change. All right, suspension for new applicants. New applications received after October 24th, 2020 from people who are already incarcerated may go right into a suspension if they're eligible. So there's no requirement that somebody has to be eligible for full benefits or eligible without being incarcerated before they go into a suspension. They can go right into a suspension if they're already incarcerated. If a new applicant was incarcerated after the first of the application month, the suspension will start the first of the month following the application month. So in general, the rule is a person must be incarcerated the full month in order to be eligible for suspended benefits that month. If the person is only incarcerated for part of the month, they are eligible for full benefit Badger Care Plus for that month, assuming they meet the other eligibility criteria. So an example here, Aaron has been incarcerated since June 15th, 2020. He submits a new application on October 26, 2020. He does not request backdated benefits. Aaron is eligible for suspended Badger Care Plus starting October 1st, 2020. And just to note, healthcare in general generally starts the first of the application month. This is just a general rule, incarceration or non-incarceration. So no matter what day of the month the application is submitted. So if somebody submitted an application today, October 6th, the application month, is October. So the application would go back to October 1st, assuming the person did not also request backdated benefits. All right, special rules. Shannon, do you want me to pause here or keep going through the special rules?
Let's go through the special rules and then we'll do a bunch of questions.
Okay, sounds good. So children, so if the only adult or adults on the case are incarcerated, children on the case will continue to be eligible for health care on that case for up to 3 months. The purpose of this is to minimize disruption to a child's health care while the child transitions to a new living situation. The child can become eligible on another case, such as their other parent's case, prior to the end of the 3-month period. Again, this is only for situations where The only adult or adults on the case are incarcerated. There's no adults left in the household. So that's why this special rule is in effect, because we know with no adults in the household, the child must be moving to a different household. Incarcerated children are not subject to premiums for the months in which healthcare is suspended. Rules on childless adults. So childless adults, just to give a little background, are adults ages 19 through 64 who do not have dependent children living in their home. Incarcerated Badger Care Plus childless adults are not subject to premiums for the months in which healthcare is suspended. Childless adults are not required to answer the treatment needs question to gain or maintain suspended Badger Care Plus, but just to know, they may be required to answer that treatment needs question to gain full benefits at release. So that might be something they have to do once they are moving back to full benefits. Out-of-state incarceration. So if a person is incarcerated in Wisconsin and then involuntarily transferred to a correctional facility in another state, they are still considered a Wisconsin resident. If a person has committed a crime outside of Wisconsin and is incarcerated by that state in a correctional facility in that state, they are considered to be a resident of that state and not Wisconsin. All right, Shannon, I think I'll pause here, and I saw some questions pop up.
I think that would be great. So one of the questions is, are any of these policies related specifically to COVID-19 in any way?
No, these are not necessarily related to COVID-19. This is a separate thing. Again, there might be some COVID, for those of you that attended the COVID-19 presentation yesterday or have heard it through other things, there might be some impacts that the COVID-19 policies have on this, as in if somebody is, like we have to keep people on, keep people open for benefits during the public health emergency and things like that. But these policies are separate from COVID-19. They will continue on even after the public health emergency ends.
Okay. Next question. So if the person has Huber during the day and is sleeping at the institution at night, would he or she be on regular Badger Care or suspended Badger Care?
If the person is being released during the day for the purpose of returning to the home and taking care of their minor children, they would be eligible for full benefit, Badger Care Plus or Medicaid, regardless of if they're returning to the facility at night.
Great, thank you. Why would an incarcerated person enroll in Badger Care Plus when they're incarcerated? Wouldn't the Department of Corrections, I think, maybe cover those charges? And Lars, if you want to jump in here, feel free.
Yeah, from the DHS side, and of course Lars will be able to jump in. I think the benefits of this are more about if somebody wants to, I think there's probably a couple populations that could benefit from it. If somebody has maybe some chronic health issues where they are frequently going to the hospital or something like that, even while they're incarcerated, those folks may be interested in getting the suspended benefit because it would cover those hospital stays for them. Another population that might be interested in having suspension would be folks who want to take the time now while they're incarcerated to sort of do the application or do whatever is needed to get on benefits in preparation of, when they are being released. We know that that's a very busy time for folks, a lot of things going on. And so it would be easier for them to just transition that to full benefits at that time by just reporting their change in living arrangement status to their income maintenance agency versus having to do a brand new application at that time when they might have a lot of other things that they're doing. And then Lars, I don't know if you have anything else to add to that.
I would say that the DOC will cover any charges for medical costs that are incurred while incarcerated, with the exception of inpatient hospital stays.
Okay, thanks. Why don't you go ahead, Rachel, and then we'll do another batch after this.
Sure. So redetermining eligibility at release. When somebody is released and this information becomes known to the IM agency, eligibility can be reinstated without a new application for benefits. So again, for DOC inmates, we expect to receive this information automatically via data exchange. For inmates of jails, we will continue to rely on direct reporting from members. If the member continues to be eligible, full benefits are reinstated the first of the month in which the member is released. If the release date is known prior to release, the IM agency will do a pre-release redetermination a few weeks prior to the release so that the member has full benefits when they walk out the door of the jail or prison. Example of how this works. So Cameron is incarcerated and enrolled in suspended Badger Care Plus. Cameron's scheduled release date is December 15th, 2020. The IM agency received his release date through the data exchange with DOC in October 2020. So prior to December 15th, the IM agency redetermines his eligibility because they already know the release date. Cameron's full benefit Badger Care Plus starts December 1st, 2020, because remember, he's not incarcerated for the full month of December, so he's actually eligible for full benefits in December. So that he has access to full benefits right away when he is released on December 15th. Important reminders after release. So members must follow change reporting rules and report to their IM agency changes, such as if they have a new address or a new job. Very important to remind people that they do need to report this information after release. Members must remember to submit any requested verification and complete renewals. If a member does not have a reliable place to receive mail about their benefits, members can designate their IM agency as their mailing address and pick up mail there. That's available to anybody, regardless of if it's somebody who's been released or just somebody who does not have a reliable place to receive mail. They can use their IM agency and pick up mail there. Members with regular access to email can sign up for electronic notices through Access. So some folks may prefer to not get all their notices by paper, but prefer to be able to look at those electronically through their Access account. And I'll go right into Access in My Access. So Access changes. So the Access application with these new questions about incarceration, it will be updated so that we can ask, about the incarceration start date, the release date if known, jail or prison facility name or address. The application will also ask if the applicant is considered part of the household. Again, these questions in the Access application are dynamic. So if somebody's not incarcerated, they're not going to see these questions. So it's not going to extend the Access. I know the Access application is very long already. It's not going to extend the Access application for people who are not. The Renew My Benefits and Report My Changes modules in Access will be updated with similar questions to ask for incarceration information when a member is reported as newly incarcerated, released, or moved to a different facility. My Access. So while members will likely not have access to smartphones while in jail or prison, once they are released, the My Access app can be a helpful tool for managing their benefits. And then just a reminder, so members with authenticated My Access accounts can download the My Access mobile app to do the following: check their benefits, get reminders, submit documents by taking pictures with their phone, and then that My Access mobile app can be downloaded for free at the App Store or Google Play. And member communications, I'll go into this real quick. So again, the notice of decision, talked about that earlier, will clearly state if a member will have their Badger Care Plus or Medicaid put on hold, suspended, put on hold. It will also include information about what it means for the member to have their benefits suspended. If they have a renewal while they're incarcerated, that will also include information about suspension. And then we'll also be sending out informational letters to the incarcerated member at their jail or prison address, if known. So a letter will be sent when the suspension starts that will explain what it means for the member to have their healthcare benefits suspended. And then a letter will be sent when the suspension will soon end that will explain that benefits will no longer be suspended and sort of what that means. So I don't know if we want to do the poll question now or take a break for questions.
Let's do the poll question. So go ahead and pop it up, Mike, if you can. So we'll give everyone a minute here. And I can read it. In order for the suspension to be lifted and the member to get full benefits upon release, the member must file a new application for Badger Care Plus or Medicaid. True or false?
I think we need some Jeopardy music here.
I know. It's awkwardly quiet. Everyone is focusing. Okay.
All right, great. I see the results. Yes, it looks like most folks did select false. which that's the correct answer. Once the policy goes into effect anyway on October 24th, 2020, people will not need to submit a new application to get full benefits if they are already suspended. They'll essentially just need to report that change, their change in living arrangement, that they are no longer incarcerated. They'll need to report that to their income maintenance agency. So new application not needed.
Okay. So thanks everyone for participating in the poll. We're going to cover a number of the questions now, and then we will shortly transition to Lars. Rachel, that was the last part of your presentation, correct?
Yes, I'm sorry. Yes, let me move and then I just have a
Okay.
slide that if people have additional questions they think of, I know this is sort of a big change and a hot topic, please feel free to email the email address on the screen, dhs@wisconsin.gov, and we can certainly take your questions there.
Great, thanks, Rachel. If you can, after we go through the questions, maybe pop that address into the chat so people can copy it. That would be great.
Yes.
While we're doing questions, if Lars and Mike work together to queue up Lars's presentation, that would be wonderful. And then we'll go through questions here. So we have some questions. If this current acting policy or will be implemented very soon. Okay, so we know the policy will be implemented very soon, October 24th, right, Rachel?
Yes, October 24th.
How will maintenance of effort requirements in conjunction with federal COVID relief legislation impact ability or timing for redeterminations of suspended members?
Sure, and this is something that I think we've been internally talking about within DHS. I think, assuming that the public health emergency still continues on, if somebody is enrolled in suspended benefits, we will keep them on suspended benefits through their incarceration. If they continue to be incarcerated during the public health emergency, we'll keep them on, of course. I don't really have, I think, much more details right now, but we do know we're working on this and making sure that we do comply with that maintenance of eligibility and other the COVID-19 requirements.
Great, thanks, Rachel. And this one could go to, I think, to whoever is best positioned to answer it. So Rachel or Lars. It says inmates are required to make copays to see the doctor. Would copays be waived if the incarcerated person is eligible? And we might need some clarification on the question.
I will say from the DHS side, we don't have any special policies on waiving copays for inmates. Inmates who are receiving services that are covered by Medicaid or Badger Care Plus would be subject to the same copay rules. I will say in practicality, the providers that are providing those services may decide not to, try to collect those copays. That's possible, or they may waive the copays for that population. That might be a decision that's made, at the provider level. But just from a policy standpoint, we don't have anything at the policy level that's waiving copays for the inmate population.
I think I can clarify that too, Rachel. So individuals who see a doctor within the Department of Corrections health system have a copay in order to see that doctor. So those copays would not be waived with suspended status. They will be provided the services by the department. We can't reimburse those or ask for reimbursement for those costs through Medicaid. So they would have to continue to pay those copays.
Okay, so I think with the two of you together, this is an example of why it's great to have both of you here this morning. We were able to address that question. So we have another question kind of about payment, and the question is, does an inmate get a bill from the Department of Corrections upon release for medical services? For example, a 2-hour trip to the hospital, even though the Department of Corrections might pay the bill, at the moment?
The short answer is no. There have been situations where, during that transition, an individual is billed for services they received while incarcerated, but we ask that individual contact the institution and we work through those issues to cover the cost. An inmate should not see any health-related costs other than those co-pays while they're incarcerated.
Okay. And Lars, if you can, is there a specific amount for those co-pays, and do people generally, how are they paying those? Are they paying them after they're released then, the co-payments owed, or how does that work?
No, they cover the cost for them while they're incarcerated, and I believe they're $7.50, but I'm not sure of that.
Okay, thanks. And then back to that billing question, is this different depending on the institution? So county jail versus a state prison institution?
Yeah, so there were questions about emergency room visits and applications during that time. If an inmate goes to the emergency room from a DOC facility, DOC covers the cost because they're not admitted to the hospital. Once they're admitted to the hospital, then those costs can be covered by Medicaid. But generally DOC will take care of that application process. We have a staff member who is dedicated to that work.
Okay.
And I can't speak as specifically for jails, although I believe the jails still cover the cost of emergency room visits. I'm not as clear on that process.
Great. Okay. I am just looking through the questions here. So I think we will pivot, Lars, and move to your presentation. And then I will comb through the questions I received to tag back on any we missed. And then I'm sure we'll have new questions as you present. So keep those questions coming. If I missed your question, remind me of it. Pop it back into the chat again to get it back to the top. And I will hand it over to Lars to talk to us about the process, what this looks like from the Department of Corrections viewpoint. Go ahead, Lars.
Good morning, everybody. My name is Lars Brown. As Shannon mentioned, I work in the reentry unit, which is situated in the Office of the Secretary in the Department of Corrections. I'll give you a quick overview in a minute, but first I had a question before the presentation from Shannon about why suspension is important. I'm not going to answer that question right now. I prefer to answer a different one, but I will come back to that, I promise. Why is access to healthcare important for individuals at the point of release? And there's sort of a big picture way to look at that using Wisconsin data. Almost 70% of individuals in prison have a substance use disorder treatment need. 70%. 7% of men and 35% of women in prison have a serious mental illness. That's twice the national average for men and several times higher than the national average for women in the community. It's widely held that the prevalence of chronic health conditions is much higher in incarcerated populations than those in the community. And there's also research that supports the need. A study by Dr. Ingrid Binswanger and her colleagues found individuals releasing from prison in Washington state were 12.7 times more likely to die during the first 2 weeks after release than a matched sample in the community during the same time frame. So it's really essential that individuals releasing from prison have access to health care during this tumultuous and unfortunately sometimes fatal period immediately following release. And there we go. Having trouble advancing the slides. So as we talk through the details of application assistance for the justice involved, I'd like you to think through these two questions on the screen. First, in the context of your work, and I understand there's different professionals represented here, but please think about the ideal situation for individuals leaving incarceration. And then what steps can we take to make that ideal a reality? Please feel free to describe your answers in the chat and we can use them to guide our discussion here at the end of the session. And I mentioned the overview. I'd like to talk a little bit about what's happening to address concerns at the point of release. We'll take a historic view of where we started, our current practice, and the data the department has to demonstrate our efforts. We'll talk about how things will change after suspension. I want to at least talk a little bit about marketplace considerations, and then I want to make sure that we have time for those questions. So first, the history of DOC application assistance. And this is broken down into kind of chunks of time. So prior to April 2014, many of you will remember the wait list for individuals without dependents. Incarceration also impacts that custody situation because individuals often lose custody while they're incarcerated. So because of those issues, many individuals prior to that time there wasn't a lot of interest in applying, and DOC didn't facilitate a process. After April of 2014, things changed significantly. The wait list was eliminated. Medicaid eligibility now really hinged on a simple economic test. At that point, DOC partnered with DHS to establish that inpatient application assistance process, which we've been talking about. And so DOC began submitting those Medicaid applications for those individuals. I want to share here that researchers at the University of Wisconsin have studied these timeframes. That paper hasn't been published, but their findings indicate sizable increases in Medicaid eligibility as advocacy is increased. Prior to April 2014, for example, the percentage of individuals with Medicaid eligibility determined during the month of release hovers between 5 and 10%. Beginning in April 2014, with all of those changes, it increases and remains between 35 and 40%. So beginning January 2015, DOC implements its application assistance process for individuals prior to release. DOC and DHS developed an agreement that allowed us to do that, and then DOC facility and contracted staff begin facilitating applications. In August 2016, DOC and DHS reworked that agreement to allow information sharing. And that was critical because it allowed us to evaluate how we were doing with that application assistance process and make improvements. And really at this point, application assistance is really institutionalized, it's concrete and becomes a part of release planning. So we see another significant increase in the percentage of individuals determined eligible after DOC implements application assistance in January 2015. That percent climbs to 60 to 70% in April 2015 and has consistently remained there. And because of this information, I'm hoping that you realize that the positive impact of application assistance on eligibility determination is really quite clear. And we are going to talk about that application assistance process quickly. I mentioned that DOC has successfully integrated the process into release planning. The department has written policy, required training for specific classifications, consumer materials, a layered assistance approach, continuous quality improvement practices, as well as a very strong partnership, as evidenced here today, with DHS. The department has also contracted with Legal Action of Wisconsin. Some of you are familiar with LAW. They run the Reentry Legal Services Program, which was formerly known as the DOES Project. So we'll talk about those in a little more detail. You can see here that the department has guidance documents at several levels for their staff, including EDs, executive directives, policy, and procedural manual for our staff. We provide consumer materials, and those are posted for families as well as individuals who are incarcerated, and our staff distribute those in field offices as well. We also have staff training, which is in an online format and has been updated recently, October 2019. And this year, we'll have to update that information again to include suspension information. All right, so individuals in our care identify at approximately 6 months prior to release if they want to apply for Medicaid programs. It is a voluntary process. And if they do, the release planners use their professional judgment as well as a set of criteria to evaluate if they need an assisted call. This is part of that layered approach. If not, individuals make their calls unaided to the Income Maintenance Consortia. In both cases, the application process is conducted over the telephone with the Income Maintenance Consortia covering the county to which that individual will be releasing. Individuals placing unassisted calls have access to the institution phone system and the toll-free numbers, or a scheduled call in a particular area, depending on that facility's procedure. This design reduces our release planners' workload where possible. It also puts responsibility on the potential Medicaid member from the beginning of the process. From a CQI perspective, verifying the release date has really become the one flaw in this entire process, because when an individual is calling unaided, it's difficult for a staff member to verify that release date. So the way we try to resolve that is through interagency communication and training, and referring back to Operations Memo 1449 and the Badger Care Plus manual to guide the ideal process. This assistance from DOC staff provides another layer in the application process. The department screens and identifies individuals that may need additional help with the call. Release planners screen their caseloads for releasing individuals in one of 4 categories, determining if they need assistance, they schedule time, and place the call with that individual. Previously, the staff member and individual had to be co-located. This is one of the impacts of COVID-19. DHS has now given us the opportunity to make those calls in a conference call scenario, maybe with an individual who's incarcerated in one part of the facility with a staff member in another, and then calling the Income Maintenance Consortia. During the design process, reentry planners advocated, I am going to back up just a second. Sorry about that. During the design process, reentry planners advocated for another level of assistance for facilities with the highest number of releases among individuals in one of the 4 categories. It was intended to free up DOC staff and allow release planners to focus on some of those more complex tasks associated with release. So the Reentry Legal Services contract is held by longtime collaborating agency Legal Action Wisconsin. And this effort really dovetails nicely with the primary reentry legal services function, which is to facilitate expert Social Security application assistance through legal action attorneys. Due to limited funding, we were only able to identify and staff 5 facilities with 3 paralegals. Those facilities are Oshkosh, Tachita, Milwaukee Secure Detention Facility, Racine, and Sturtevant Transitional. Both of those are co-located, so we treat it as one facility, and Robert Ellsworth Correctional Center. And since I oversee the Reentry Legal Services program for Department of Corrections, I'm proud to point out that these 3 paralegals provide assistance for approximately 20% of all of the successful applications prior to release from prison. So I do want to talk for just a minute about the marketplace. Many of the individuals releasing from prison will qualify for Medicaid programs. However, due to work release, retirement and pension income, and stipends, among other reasons, some individuals release with income higher than the poverty level. So we provide information about the marketplace. The department added premium payment as an allowable use of pre-release funds. These are funds that are intended to help individuals get on their feet and really save money for getting on their feet in the community. And they can only be used for specific purposes, which now premium payment is one. Wisconsin DOC supported community groups as they advocated for a special enrollment period to start prior to release from prison. But unfortunately, that didn't happen. So what we see is that there are not a lot of questions from individuals who might qualify for it prior to release. But we'll talk a little bit more about the marketplace here in a minute. Shannon, did you want to take a break for questions?
Yes, thanks, Lars. I'm just sorting through them now, so sorry for the pause there.
No problem.
So our first question is, I believe Mr. Brown mentioned that there is a person at the Department of Corrections that assists individuals for applications. How can we get contact information if any questions with a person's Medicaid application arise? So I think like how might they reach back to the DOC if needed for questions?
So I would say the first part of that question, we do have individuals who assist people with applications prior to release. Those paralegals that I mentioned also are reentry planners. We have one person dedicated to the inpatient application assistance process. But since there are different people there, I would just recommend that you contact me. My information will be at the end of this presentation, and then we'll work on it from there. I think it's easier to have one point of contact rather than trying to figure out who within our 10,000 employee pool might be the person to talk to.
Thanks, Lars. We appreciate that. We always appreciate the point of contact. So next, we just want to revisit something that was talked about earlier about emergency department interaction. So I received an update from a DHS representative via the chat that emergency department patients who do not have coverage and stay in the hospital for over 24 hours are allowed to have an EE, an express enrollment application to cover the stay, but this will only be offered one time per year. So we just wanted to share that update with you all. And now we have a question for you, Lars. Does the work individuals in our care count? Oh, does the work done in the institution count towards Social Security credits? This one's a little off the.
I would say yes for work release.
Okay.
I believe that's the case. I do believe inmates pay when they leave the institution and they're receiving a living wage. They do pay into all of the required. They pay taxes and all of the fees associated with their work. So that's different than institutional jobs where we don't do that. And institution jobs have a much lower wage associated with them.
All right. Thank you for that response and that clarification. Why don't you go through this next section, excuse me, and then we will do more questions after that.
Sure. So one of the things that I want to provide is a look at the data. As indicated on one of our earlier slides, since 2016, DOC has had agreement with DHS to exchange information about individuals leaving prison and their Medicaid eligibility. Because of the agreement, we could track outcomes and show how successful formalizing the process as part of the pre-release planning process has been. And you can see that on the screen. You may have to adjust your video box to see the entire thing. But this is annual release and application data for fiscal year 18 through 20. It shows eligibility determinations for incarcerated individuals leaving prison. You can see that the blue stacked section of the stack column reflects individuals determined eligible, orange individuals who did not apply, and that sliver of gray across the top is individuals denied. And I would just point out that the trends are all going in the right direction for this application process. Even though the stack columns don't necessarily represent it, you can see in fiscal year 18, we're at 67% determined eligible, fiscal year 20 over 70%, heading in the right direction with that trend. Conversely, with the orange sections there, we start at 28% for individuals not applying. We're down to 26% and change for fiscal year 20. And the eligible individuals denied is also heading in the right direction, starting at 4%, moving down to 3.4. So I would point out, just in general, that 70% of individuals leaving prison with eligibility determined either the month before, the month of, or the month after release is pretty significant. And it's taken a fair amount of time to get there. Another thing that I'll point out is that a 5% increase in fiscal year 20 would result in 447 more individuals releasing from prison with access to healthcare. So that is a picture, a snapshot of the data. And now we'll talk a little bit about suspension. I do have to admit, I faced the DHS announcement that we were moving to suspension with a little trepidation. As you've just seen from the data, DOC established a process over the last 5 years that is moving in the right direction and actually represents a significant investment in time and resources to get us there. However, and this is where I hope to address Shannon's question, suspension is very likely to increase eligibility determinant release, in turn increasing access to medications, mental health treatment, including substance use disorder treatment, and healthcare for chronic conditions at release. And the statistic I mentioned earlier, the relatively modest 5% increase, is how I expect that change to manifest itself in our data. I expect over time, the largely administrative process will increase our eligibility determinations and will show a benefit for released individuals during that really challenging reintegration process. In addition to the legal requirements for suspension for some of the populations that Rachel mentioned earlier, DOC supports suspension because it is likely to benefit supervised individuals' health outcomes in the long run. So what do we expect to change in the prison system as a result of suspension? The short answer is really not all that much. And I say that because much of the work for the initial stages of suspension is going to be automated. Information sharing exists now between DOC and DHS, or at least the agreement does, where we're going to provide information to accomplish suspension of Medicaid eligibility. We'll identify individuals entering DOC supervision to DHS, and they'll match it in the care system. We'll update addresses as individuals move from facility to facility, and that facilitates DHS communications with those suspended members. And finally, we'll provide a release date for those reinstatement operations to occur administratively. Obviously, there's a fair amount of work that DOC has to do with updating all of those materials that are listed there, but it certainly will, I believe, become a much more streamlined process in the end. Individuals with suspended eligibility will also have requirements, and Rachel mentioned some of this, but those will be similar to their responsibilities in the community. They'll have to respond to DHS and income maintenance consortia inquiries. They'll have to notify their release planners that they are in a suspended status and that they expect to be reinstated. That will happen about that 6-month mark prior to release. And then they'll have to update their addresses when they know where they will be living when they release. It's important to understand that DOC populations are not monolithic, and that certainly is no different when we're talking about Medicaid eligibility situations. So individuals come into prison, they may never have had eligibility determined. They may have had periods of eligibility prior to incarceration, but were not eligible when they were incarcerated. And they may have been terminated because of an incarceration that occurred prior to October 24th, 2020. But there are also individuals who will come in with a suspended status or are suspended because of an inpatient hospital stay while they were incarcerated. So everyone in those first 3 groups, and I think this was a question in the chat, will continue to apply over the telephone on the 20th day of the month prior to their month of release, same way that we're doing it now. But we anticipate that within 3 years, about 70% of incarcerated individuals will be in a suspended status. And that's just based on what we're seeing when individuals leave currently. We assume that we'll be taking in roughly the same percentage of individuals who have eligibility determination, but it takes about 3 years to turn over our entire population. And I just want to touch on the marketplace quickly. So we figure that somewhere between 8 and 15% of incarcerated individuals are earning living wages in work release programs or fall into that category where they are receiving stipends or pensions that would disqualify them for Medicaid. So many of those individuals could potentially sign up for health insurance plans and about the time of release. They can't really do it before because of that special enrollment period starting the day of release, but they could certainly prepare everything to do so. I'll be honest, DOC doesn't really have good data on what that looks like, and the department can improve advocacy in this area. We certainly do provide information to individuals, and I think there are individuals who apply, but many of them do it on their own. But anecdotally, the people that I've talked to who are in those work release programs really expect to get out, find a job, and get health benefits pretty quickly after release because they are developing skills while they're incarcerated. I will share a couple of practical tips. One is fairly technical, the other is more general. Individuals who are applying for the marketplace shortly after they release often need some kind of proof that they're no longer incarcerated. And often that throws them for a loop. They'll contact the institution. The institution staff aren't typically used to doing that kind of work, so they will they'll start calling around and asking. And really all that they need is to go to this DOC locator. The link is on the screen. There's information about individuals who release that is public information. There's a status tab that indicates that the individual is in the community on community supervision. So that's hopefully one helpful technical tip. More generally, I would say that individuals who are coming out of incarceration often need as much education as they do assistance about what coverage and insurance means. And there's so much that happens the second you walk out the door of an institution if you are incarcerated, where you're taking on all the responsibilities of adult life at the same time, and it's difficult for individuals to prioritize those. So it behooves all of us to be patient and help educate when we're interacting with individuals who are recently released. And that's just my personal opinion after working with this population for the last 20 plus years. Okay. And finally, I would just share with you that I really enjoy doing these presentations because I get an opportunity to interact with individuals, professionals who are committed to community service. If there ever is a time that you need assistance, as we talked about earlier, or there's an opportunity to collaborate, please contact me. My information is here. I'm quick to respond, and I would be very happy to work with you on any issues that come up. And now I'm going to stop sharing my screen and turn it back over to Shannon to further address questions.
Wonderful. Thank you so much, Lars. So I just want to note that we are at time, but we are going to continue for another few minutes to get through questions. I'm hoping to at least address 3 additional questions. So the first one is, and we got this twice actually from 2 different health centers. So I work for a community health program. Once we have open enrollment, can we advertise our services in different settings so incarcerated individuals and their families can access them? So essentially they're saying, how can we connect with the DOC to offer remote support for marketplace enrollment services? Lars?
So I would say that it's easier for the department to deal with that on a statewide level. And we, Shannon and I, Wisconsin Primary Healthcare Association, the community health centers are already in conversation about how to do that. Unfortunately, we don't have an answer for you yet, but I think there's work forthcoming that will better connect individuals to the health centers at release.
And please, if you're interested in joining that work, let me know as well, and we'll put you on that work group with community health centers who are discussing these issues. We're delighted to have you and your participation. So we're going back to a question, and this one's for Rachel about Medicaid and Badger Care policy. So we had a question about the child of an incarcerated parent. So the question was, what I'm hearing is that the child of an incarcerated parent only has coverage for 3 months following suspension. If there is no other parent for the child to be enrolled under, does the child go uninsured after 3 months?
Yep. So I guess just to take it back a little bit and make sure I'm clear about the scenario. So this scenario, we're talking about children where because they're the only parent or parents or basically the only adults in the household are now incarcerated, there are no adults in the household with a child. So just to be clear, if there is still a parent in the household with a child, like my Ty and Paula and their child Marcus example, where Paula and Marcus are still in the home, they would still be eligible on that case. The child could still maintain benefits on that case. But for this example here, where there are no parents in the home now, they're all incarcerated. For that one, the reason why we're allowing that 3-month grace period for the child to maintain coverage on that case is to help so that the child doesn't have their coverage dropped right away because there's no adults on the case, that they sort of have this grace period, so to speak. And the idea is that our thought is in most cases, or generally, this child is going to end up somewhere. They're going to either end up with another parent or relative and in that household and could be eligible on that parent or other relative's case. And in that case, the child's eligibility could move from, when they move to that new household, they would close down on their old household, their eligibility, and then they could join that new household, or that other parent or caretaker could apply for the kid on that other household. And so the kid would regain, Badger Care Plus, say, benefits over there. There could be situations where the child is moving then to out-of-home care or foster care, something like that. And in that case, the child would become eligible for foster care Medicaid. That's a different Medicaid program there. So the child could get eligibility there. There could be cases where the child moves out of state, or they move to a different household that has, other insurance through other health insurance through other ways, and they get coverage that way. So the hope is that the child doesn't completely fall off the radar and lose, eligibility completely. But the hope is that 3 months gives time for the child to regain, gain coverage some way through their new, household or their new living situation, and that's how they can maintain coverage one way or another.
Thanks for that clarification, Rachel. I appreciate it. We have a question about Medicare. So what if a person became eligible for Medicare, meaning they turned 65 while they were incarcerated? Can they have Medicare while incarcerated? And are they assisted with enrolling in Medicare when they know they will be released? So to either Rachel or Lars.
So I've dealt with this on occasion, and what we recommend is that if an individual becomes eligible, they wait until, while they're incarcerated, they wait until their year of release and then apply during an open enrollment period. What that means, though, is that they have to maintain their premiums for Part B, I believe, during their incarceration. So they have to be aware of that. But the benefit of that is that once they release, they have access to Medicare, especially if it's not going to be during an enrollment period, right? So there was one more point that I wanted to make about that. An individual who has Medicare established can't use those services while they're incarcerated. And it really then becomes that person's responsibility to think through how they want to handle continuing to pay premiums while they're incarcerated. They may get some guidance for that process, but it's not something that our social workers deal a lot with. So they often contact me for those questions.
Thanks, Lars. Okay, we're going to do two more and then we're just going to have to conclude because of time. This one is slightly off topic, so if you can address it, great. If you can't, that's fine. For inmates who are in prison and they're working, is that wage put towards owed child support? Do we know, Lars?
Can you run that by me one more time?
Sorry. For inmates who are in prison and working within the prison and earning the wage offered, is that wage put towards child support payments? And if you don't know, it's okay. This is left field.
Yeah, so there's two different ways to think about that. Those institution jobs where they're making sense really on the dollar, they don't make enough to really be considered for those payments. But individuals who are making a living wage outside the institution during work release, I believe those individuals are subject to those child support payments.
Okay, thank you. And do we have any idea about how many of those 18 to 15% of incarcerated people eligible for the marketplace would be eligible for Medicaid if it was fully expanded to 138% of the federal poverty guidelines?
I don't have any idea. I would say that many of the individuals who are part of work release are making well above minimum wage.
I think that's helpful. Thanks. Okay, so in conclusion, because we're out of time, Rachel, can you share one more time when this policy goes into effect?
Sure. So our changes to the Badger Care Plus and Medicaid policies, where we can start suspending people who are incarcerated, starts October 24th, 2020.
Excellent. Well, thank you so much, Rachel. Thank you, Lars. I know there are some additional questions that we didn't get to, and I apologize for that. I'll hand it back over to Allison.
Thank you, everybody. You can see my clothing behind me. I had to switch rooms. I'm sure you're all familiar with that scenario. Regardless, thank you so much. This is really amazing information. And I really appreciated all the detail, as always, with the policy, but then also, as Lars, as you pointed out, just how can we, as enrollment assisters, help support people in this process? Hopefully, in the bigger picture, it's actually just making it easier overall, but there's always still things that we need to help make sure people don't fall through the cracks. So we'll have a short break and we'll be back here at 10:45. So get up, stretch, and we'll see you again in about 15 minutes. All right, thank you.